All right, good afternoon. We're going to go ahead and get started. This is the third meeting of the Health Services Committee. I appreciate everyone being here today. As a reminder to all committee members, we have members who are going back and forth between state government and this committee meeting. If you need to record a vote, you need to you cannot do so during a discussion of a different roll call. So we'll call on you separately to record your votes. You just need to let us know and ask to be recognized. So we do have a full agenda today. We are going to go ahead and get started. DJ, if you could please take the roll.
Representative Bratcher. Here. Representative Bray. Present. Representative Burke.
Here.
Representative Callaway.
Present.
Representative Camuel.
Here.
Representative Dotson.
Here.
Representative Fleming.
Present.
Representative Gordon.
Yes, sir.
Representative Holloway.
Here.
Representative Marzian.
Here.
Representative Neighbors.
Here.
Representative Proctor.
Present.
Representative Rayburn. Representative Raymer. Representative Riley. Representative Sharp.
Present.
Representative Wilner. Vice Chair Duvall.
Here.
Chair Mosier.
I am here. We have a quorum established to do business, so we are going to go ahead and get started. The first bill I'd like to hear is House Bill 392. Representative Proctor, if you want to just make your way to the table. Just introduce yourself for the record and proceed with your testimony.
Thank you. I'm Representative Marianne Proctor. I represent the 60th District, which is part of Boone. I want to thank Chair Mosier today for the opportunity to present House Bill 392. This is what I would call a continuing improvement bill. What it does, the rationale for this bill, it came from the Department for Behavioral Health, Developmental, and Intellectual Disorders. What they do, the problem is right now is getting monies for services that are provided outside the facility. So patients who are in our state facilities of this department, which are psychiatric hospitals, it could be intermediate care facilities, it can be nursing, there is in statute that the department is required to pay for medical and psychiatric services for these patients. Unfortunately, sometimes the facility in which they are being treated is unable to adequately meet their needs, and they may need emergent medical services at a community-based facility.
Thank you. We have a motion and a second on the bill. Do we have any questions from the members? Okay. All right. Thank you. DJ, please take the roll.
Representative Bratcher. Yes. Representative Bray. Yes. Representative Burke.
Yes.
Representative Callaway.
Aye.
Representative Camuel.
Yes.
Representative Dotson.
Yes.
Representative Duvall.
Yes.
Representative Fleming.
Aye.
Representative Gordon.
Yes.
Representative Holloway.
Yes.
Representative Marzian. Yes. Representative Neighbors.
Yes.
Representative Proctor.
Yes.
Representative Rayburn.
Pass.
Representative Raymer. Representative Riley. Representative Sharp.
Aye.
Representative Wilner. Chair Mosier.
Yes, sir. Okay. House Bill 392 passes with favorable expression. 15 yeses, 0 noes, 1 pass. The same should pass on the House. Thank you very much. Okay. The next bill that I would like to take up is House Bill 580, and I will come down and present if my vice chair could take over for me for a few minutes.
Okay. Next bill we'll hear is House Bill 580. Representative Mosier, would you please state your name for the record and introduce any guests?
Of course. Thank you, Mr. Chairman, and thank you, members, for the opportunity to talk about this bill, House Bill 580. Well, I'm Kim Mosier, State Representative of the 64th District. I need to introduce myself for the record, and I'll ask my guest to do the same.
Good afternoon. My name is Elena Sweezy. I'm a social worker and a lobbyist.
And we do have a sub on the bill, is that correct?
We do have a sub.
We have a motion to second. All in favor? All right, motion carries.
Thank you. All the sub does is cleans up a title error. It in the committee substitute, it said relating to, oh wait. So this is, the committee sub, I'm sorry. We are adding educational requirements. We have a title later. Yeah, my bad. Okay, so what we are looking to do with House Bill 580 is simply tighten up some of the guidelines around our peer support specialist. We passed House Bill 505 last year that created some infrastructure and oversight of peer support specialists. And we need to reinstate some of the supervision that was relaxed last year. And we also need to reinstate some of the parameters around group sizes that these great employees but non-clinical folks are providing services to. And I mean, really that we have some educational requirements. We do need to, at some point, not in this bill, but probably over the interim and maybe next session, look at board structure. We're not doing that today, though. So I would just invite Elena to say a few words about the importance of this bill.
Thank you, Rep. Moser. Good morning, members of the committee. My name is Elena Sweezy. I'm a social worker. I'm a person in long-term recovery, been in recovery for over 12 years. I have a decade of experience working in and with substance use treatment. I also happen to be the second person in the state to be registered as a peer support specialist under the Board of Alcohol and Drug Counselors back when it started in 2016. I represent several treatment providers who believe that peer support is a critical part of substance use disorder treatment, and we are committed to raising the quality of services provided by peer support specialists that work in substance use treatment. Myself and other experts in the field have worked together during the interim to elevate standards of care, try to prevent overbilling issues, which we have heard about from DMS this year, but still fully utilize this valuable credential. This legislation builds upon the foundation established by House Bill 505 from last year. House Bill 505 laid the groundwork by requiring all peer support specialists to register with the Board of Alcohol and Drug Counselors. Because the recognized credential for peer support specialists lacked a formal process to revoke or report them, House Bill 580 takes this important work a step further by creating a clear and achievable pathway for temporary peer support specialists to become fully registered, while also providing a sustainable way for providers to continue offering these vital services. One of the challenges we faced under House Bill 505 was the issue of Medicaid reimbursement for temporary peer support specialists. This bill directly addresses that concern by incentivizing all peer support specialists to become fully registered within a reasonable time frame, specifically after a 9-month period as a temporary peer support specialist. House Bill 580 ensures they must complete the registration process and meet all the requirements to become fully registered. Even the requirements for a temporary peer support specialist under 580 are more robust than the credential that Medicaid is reimbursing for currently. This provision aligns with the goal of ensuring that every peer support specialist has a fully recognized billable credential, much like other healthcare professionals. A central reason for passing House Bill 505 last year was to bring accountability and proper supervision to the peer support workforce. House Bill 580 strengthens this goal by requiring that peer support specialists receive direct supervision by a board-approved supervisor. This ensures that all peer support specialists are being properly mentored and guided in their work, promoting both quality and safety. In conclusion, House Bill 580 is a necessary step toward ensuring that peer support specialists are not only supported in their work, but they're also held to high standards of accountability and professionalism. By creating a clear pathway for certification, addressing Medicaid concerns, ensuring direct supervision by board-approved supervisors, providing a formal process for revocation and reporting, House Bill 505 strengthens our efforts to support individuals in recovery and enhances the overall quality of peer support services across the state. Thank you for having me here today.
We're happy to answer any questions that the committee might have.
Who do we have? Representative Marzian.
Thank you, Mr. Chair, and thank you for bringing this good bill. And my question is this. Will insurance pay or reimburse registered specialists, and is Medicaid okay with this as well?
It's really, this addresses Medicaid right now.
Okay.
Last year, House Bill 505 made this a Medicaid reimbursable service. We're just tightening up the length of time that a temporary peer support specialist can practice before they're registered to also be certified to have full reimbursement. It's really up to the commercial insurers whether they cover this or not.
Oh.
Yeah. So it's not mandatory.
Maybe we should add them.
Well, I'm not opposed to having this covered. I think it's important.
It is. It is.
Yeah. So
Thank you.
But that's not what this bill does. Thank you.
Representative Fleming.
Thank you, Mr. Chairman. I just have a comment on the bill. First of all, I want to come from more of a financial point of view, but I do want to stress on what this bill is doing in terms of tighten up the policy and so forth. Elena has done a wonderful job. I've known her for a while. She is epitome of giving hand-ups to people to get them in a better spot to overcome their challenges with what they come across. So I want to publicly express her efforts and what she has done and where she has come from and where she is now. So thank you very much with that. I also want to compliment the chairwoman for taking a proactive approach to this. In the budget review health services, we are looking at Medicaid pretty tightly. And this particular code that you were speaking of has significantly increased, which causes a big concern on what's going on out there in the Medicaid world and with providers. But the providers and peer support group is vitally important in order to help with the process and getting people in a better spot. So from a financial standpoint, we need to put a control and have more of a monitoring and oversight on this particular peer-to-peer code, as well as some other codes that the chairwoman and I have talked about in doing that. So I want to express to both of y'all, thank y'all very much for bringing this forward, and I look forward to making this a better place for us to do things and get people in a better spot.
Thank you.
All right, very good. No more questions? Is there a motion on House Bill 580 as amended by House Committee Substitute 1? We have a motion. We have a second? Second. All right. DJ, please call the roll.
Representative Bratcher. Yes. Representative Bray. Representative Burke.
Yes.
Representative Callaway.
Aye.
Representative Camuel.
Yes.
Representative Dotson.
Yes.
Representative Duvall.
Yes.
Representative Fleming. Representative Gordon.
Yes.
Representative Holloway.
Yes.
Representative Marzian. Representative Neighbors.
Yes.
Representative Proctor. Representative Rayburn.
Yes.
Representative Raymer. Representative Riley. Representative Sharp.
Aye.
Representative Wilner. Chair Mosier.
Yes.
All right, very good. House Bill 580 is amended by House Committee Substitute 1, passes with favorable expression. Same should pass on the House floor. And we have a title amendment, too, we need to address. All right.
Yes.
All in favor?
Aye.
All right, motion carries.
Thank you.
All right. Next, we'll hear House Bill 688. Representative Bratcher, make your way to the table. All right, Representative Bratcher, please state your name for the record and have your guest introduce himself.
Representative Steve Bratcher, 25th District, Elizabethtown.
Yes. Good afternoon, Jeff Prather, General Counsel for the Board of Nurses.
Kim Mosier, State Representative, 64th District.
Very good. You may proceed.
Yes, House Bill 688 does basically two things. One, it addresses issues of potential fraud of people becoming nurses in other states and us adopting their license in Kentucky. And it also, on the other piece of it, it adds in some protections and some support for the education system to be able to give certain medications when needed. So I'll let the Board of Nursing talk first on this piece of it.
So during the state of emergency a few years ago, Senate Bill 10 in regular session 22 was passed, and in that it was a well-intentioned, we want to get nurses into Kentucky, and why not allow nurses who are already licensed in other states just come to Kentucky and just accept their licensure and move forward. Now, there's a couple of parts of this. One has to do with the compact, but the other has to do with and how that plays with that. But one of the unintended consequences of that, since then, there have been cases of fraud that have come up, particularly in Florida. There was a FBI investigation called Operation Nightingale, where it was discovered that several nursing schools, and they're still finding them, frankly, that were issuing fraudulent transcripts and diplomas to their nurses. And so then the nursing board down in Florida would give them a license, and then they would come to Kentucky and ask us to do that. Under the way the statutes are written now, we're obligated to review that and say, yes, we're going to let you come in and have a license in Kentucky. And what the changes to what House Bill 688 does is it provides that it puts more discretion back in for the board credential staff to review the education transcripts, the curriculum of those individuals coming in to make sure that we're not bringing we're not giving licenses to nurses who shouldn't have them because they're not educationally or not prepared with their training. And I'll take any questions.
So basically, there's some fraudulent schools out there. They're giving credentials to nurses. They're going through that state agency, particularly in in New York and California. They're getting credentialed in those states, and then under our law, we have, if you lower us in the law, it changes from shall, where the Kentucky Board of Nursing shall allow other licenses of practice. We're changing that to may, so we can evaluate the credentials, make sure that the credentials are correct, that they took the right items that they needed to take in school, it was an accredited school, and that they passed the exam. So we're just making sure that all these line up correctly with the Board of Nursing for Kentucky.
Second.
All right, we have a motion on the bill and a second. Are there any discussion? All right, seeing none. DJ, please call the roll.
Representative Bratcher.
Yes.
Representative Bray.
Aye.
Representative Burke.
Yes.
Representative Callaway.
Aye.
Representative Camule.
Yes.
Representative Dotson.
Yes.
Representative Duval.
Yes.
Representative Fleming.
Yes.
Representative Gordon.
Yes.
Representative Holloway.
Yes.
Representative Marzian.
Yes.
Representative Neighbors.
Yes.
Representative Proctor. Representative Rayburn.
Yes.
Representative Raymer. Representative Riley. Representative Sharp.
Aye.
Representative Wilner. Chair Mosier.
I would like to explain my vote, if I may.
Yes.
This is unusual, but I think it's important for folks to know what we're doing in the second part of this bill. We are adding additional rescue medications to what a school can give. We've had some bills that deal with allowing glucagon and cleaning up epinephrine delivery systems, because it's not only available in injection form anymore, but intranasal. So we cleaned that up. I said added glucagon, and we are adding solucortef for adrenal crises. And the last part of what we've done with this language is just say that if there is a prescription, if a physician or a healthcare provider writes a prescription for an emergency medication for a child to have during school, that it is allowed. This is for a known condition. So we don't have to keep coming back every couple of years and adding a new formulation or a new formulary. So that's what this part of the bill does, and I vote yes.
Very good, very good. House Bill 688 passes with favorable expression. Same should pass on the House floor. And I will turn the chair back over to Representative Mosier.
Okay. I see that our guests are here to present House Bill 16, and so we're going to go ahead and get started. We have some folks who are proponents of the proposal, and then we have some folks who are either online or in person to just give some alternative feedback, let's call it. So welcome. Please introduce yourself for the record, have your guests introduce themselves, and proceed.
Thank you, Madam Chair. Thank you today for allowing us to be here. My name is David Hale. I am the state representative from District 74. I am here today actually substituting for Representative Mark Hart. Representative Hart is out sick today and is not able to be in attendance with us, and so I'm here to present this bill. I was actually the primary co-sponsor of House Bill 16. And I will let the gentleman to my left introduce himself, and then I'll let the distinguished lady to my right introduce herself.
My name is Dr. Jack Call. I'm a practicing dentist in Louisville, Kentucky. I'm also executive chair of the International Academy of Oral Medicine and Toxicology.
Hello, my name is Cindy Batson. I am a registered nurse, a mother of 3, and I appreciate you hearing our bill today. Thank you.
Again, thank you, Madam Chair and members of the committee. I will be very brief. We will certainly not take up all of our allotted time. I've asked my guests to keep our comments to the minimum, but I will begin by saying this. House Bill 16 does one thing. It does one thing and one thing only. What House Bill 16 does is it places the decision within the governing body of the local water producers, whether they choose to add fluoride to their water drinking systems. And I want to emphasize this to all the members and everyone here today. This does not mandate removal. It just brings it back to a local body of control. It brings it back to either the local water district board, or possibly even maybe a city council that oversees that, whoever that governing board is. All this bill does is gives them the option, if they so choose, if they want to discontinue placing fluoride in their drinking water systems, then they have that choice. If they so choose to continue in the same manner as they are currently doing, this bill has no effect on that. There are, in some of my research, and I know Representative Hart's research as well, we have discovered that various water plants across the state of Kentucky are being forced to spend incredible amounts of money on this product. I actually, in some of my reviewing of some of the systems, found out that some of them were spending over $600,000 per year, actually, on this product that they were putting in the drinking water systems. Of course, not every system is that expensive. The smaller ones, of course, aren't. But this specific, is a product that, no matter where you're at on the side of this, there are many research studies that are probably pro and con. I mean, I can sit here today and I can give you some studies that we have, and I'm sure there's going to be some folks that are going to come to the table that are probably going to give you some research studies that they have that is going to attempt to refute what we are saying. But I just have a couple, and these are very reputable. One was the National Institute of Health, and another one it was a publication called the Medical News Today. They have listed in their journal and in publications that they put out the very harmful, or I will say this, the very possible harmful effects of fluoride on the body, what it has caused, what it does. And I'm certainly not a dentist, or I'm not a medical professional, but reading some of the things that it certainly has the potential to cause is quite alarming. And even an excellent facility called the Cleveland Clinic just recently came out with a study, and they said that excessive use of this product was very detrimental to the individuals that were taking this in. And I know Representative Hart has been before committees before on this with this issue, but last year in testimony, I think the most compelling testimony that I heard of anyone that gave testimony on this came from one of our current representatives, Representative William Lawrence, who works in this field. And Representative Lawrence sat at the table, and he said that he had saw where there would be containers of this fluoride product, where it had been placed on a metal grate or a metal pallet, or even on a concrete structure, that it almost disintegrated that in just a matter of maybe 2 or 3 months. I mean, that grate or that metal structure where the fluoride had maybe sloshed out of there, they had spilled some of it, or some had dripped out of the container, of what it done to a piece of metal grate. And then when you get to thinking we're putting that into our bodies, and what that is doing to our children and to ourselves and to whomever. And again, I know there's going to be testimony come that will give you information that's going to try to refutate what we're saying. But I close today with this. This is getting a lot of national attention today as well. We know that. We've seen it on the news with some national focus on this. And I'm not here to say what they're going to do on the national level, but we need to focus right now what we can do on the state level, and whatever the new administration does with this, then we will deal with that as that process comes. But right now we're dealing with this on the state level, and I just encourage the members here today to just think for just a moment and take a look at what the possible harmful effects are compared to what many folks will tell us is the benefits of this. And again, I want Dr. Call here today to just take a few minutes. And Dr. Call, please proceed with testimony, if that's all right, Madam Chair. And he's already agreed to be very brief.
Sure. And I'll be glad to answer questions. Okay, I'll be glad to answer questions as this proceeding continues, because there's so many angles to this story. And I'm here as a dentist. It's kind of unusual for a dentist to actually oppose water fluoridation. The problem is it's basically mass medication without informed consent. And the problem also is kind of a one-size-fits-all solution. There's a concept amongst toxicologists and regulators called the margin of safety. And when there's a concern about a particular chemical or substance and its possible harmful effects, and the experts and regulators are trying to decide on what level might be an acceptable exposure over time, there's assigned some kind of an uncertainty factor, most commonly used is 10. And in a lot of the recently published research funded by NIH over the last 10 years, and even the National Toxicology Program, who released their report after 8 years of production just last year, there is a sense that, if there's 1.5 parts per million of fluoride in the water, that is like a significant level that raises concern. Now, there's some studies showing even lesser amounts, like what we fluoridate with here throughout our country, of 0.7 parts per million. And some people would think, that's only half as much, nothing to worry about. Well, what they're missing are the principles of toxicology and epidemiology in which the uncertainty factor needs to be applied to that. So if that uncertainty factor of 10 is applied to this 1.5 parts per million that is of such concern, that drops your level down to 0.15 parts per million. So if I can leave you with something to really think about relative to the concern of this exposure of fluoride in the water to our population, that it's this uncertainty factor and this margin of safety that has not been applied to what we're doing. And that is a significant concern because you have women who are pregnant, you have infants, young children, and in those developing brains, fluoride is known to be a neurotoxin. And when that brain is developing, that's the last situation under which you want exposures of a known neurotoxin. And this raised the question, when there's all this uncertainty about what studies to believe in, applying what's called the precautionary principle, which is utilized throughout Europe tremendously, not so much in the United States, but still the concept applies. When there's this uncertainty about the data or about conclusions, it's a very wise choice to play it safe, apply the precautionary principle. And that's what I ask you to consider when you hear the dental profession espousing the use of this to reduce tooth decay. And there's a known topical effect, and we get that from toothpaste. And we've seen that countries around the world have had a reduction in tooth decay since, for decades, starting back in the 50s, probably more like in the 1970s, 50 years ago, in which the use of topical fluoride in the toothpaste is what resulted in great reduction in tooth decay. That's it.
Ms. Batson, would you like to add anything, please?
I would like to just add one thing. I just would like to remind everyone that having a mandate isn't the norm for the rest of the country. Kentucky is one of 13 states that have a mandate that require fluoride be added to the water, and it isn't in any purview of local governments or elected bodies. Of those 13 states, Kentucky has the most stringent mandate, and I think that's very important in this discussion as well. And I think that's all I have, and if you have any questions, I'll be open to answering them.
Madam Chair, would you like for us to take questions or wait?
I think we'll wait.
That's fine.
I'll allow the other testimony if you want to just stay close.
That's fine. I would add, if it's okay, we have 31 co-sponsors of this bill that have signed on to this, and so it certainly has drawn a lot of interest from many of our members. But we will wait.
You.
Okay, thank you.
I appreciate
Thank you very
it.
much, and we will be close by.
Of course. We do have a few folks who have signed up to speak on this bill and a few folks who are on Zoom. I think I'd first like to invite Dr. Stephen Robertson with the Kentucky Dental Association, if you're here. Thank you. If you can just make yourself as comfortable as possible and introduce yourself for the record and proceed with your comments.
Hello. Thank you, Madam Chairman. I'm Dr. Steve Robertson. I am the Executive Director of the Kentucky Dental Association, and as has been predicted, I am here to espouse the benefits of water fluoridation. Really the only response I have to the previous comments is that If we apply the principles that were brought up today, there would be nothing in our drinking water. And everyone needs to understand that. And there would be nothing in a lot of the products that we present and we supply to our people. I'm sure everyone who's been around long enough remembers the studies in the 70s about saccharin and how it caused cancer and killed everything, and then we found out the amount they were actually feeding to the mice. The studies do say that at 1.5 to 2 parts per million, there is the potential for fluoride to do damage. The vast majority of the studies say that at 0.7, which is the level that we use in Kentucky, that those negative effects do not occur, and that we get the benefit of the fluoride in the developing teeth of the infants and the young children, which helps protect those teeth as they age. Rather than getting into a debate about the study, because I will agree that there are studies that are all over the place, most of the information that I can offer is purely anecdotal. When we go on mission trips to other countries with unfluoridated water, without access to fluoride, we see the difference in the dentition of those children compared to the children at our home. And it's hard to describe that to someone that's not really a dentist, but it's actually, you've probably heard the term soft teeth, and in reality it seems that their teeth are actually softer because, to get into the science of it, fluoride replaces some of the calcium ions, which makes the tooth denser and therefore makes it more resistant to the decay. So there are a lot of benefits and years of data supporting what has been happening. You know, Maysville, Kentucky was one of the very first cities in the country to fluoridate their water. Within months of Maysville fluoridating their water in the late 50s, the Louisville Water Company started fluoridating their water. And because of the effects that they were seeing and the way that it was working in the communities, Kentucky followed through and did make it a mandate. And we are a leader in that way. Our biggest concern, in all honesty, is, and while we realize that this is not an anti-fluoridation bill, and I get that, what we are concerned about is if we give the ability for that decision to be made locally, who's actually going to be making that decision? Will they be elected and truly representing the local population or not? Will it be an appointed board that may not necessarily represent the bulk of the people in the community? And if they make this choice, there is data from the public health people that show that for every 10% of Kentuckians that are taken off water fluoridation, we can anticipate a $19.1 million increase in Medicaid expenses. And that's probably our biggest concern at this point, because I do believe from other discussions that most of you are aware right now that there are a lot of challenges in the Medicaid program, specifically in our dental program. And we're talking about potentially increasing the access issue, increasing lots of problems financially within that program with so many things in question right now. And this is really the focus of our issue. There's probably lots of other things I could talk about, but I think right now I'm going to let the other people that are online say what they have to say, and then I'll be available to answer any questions.
Thank you very much, Dr. Robertson. I appreciate your comments. Just stay nearby. I will ask Kelly Taube to come up to the table and add a few comments.
Can you hear me?
Yes.
Hi, Kelly Taube, Kentucky Voices for Health. I am the Director of Communications here at KVH, and for those unfamiliar with KVH, we aim to not only identify but address the root causes of poor health outcomes with policy advocacy. And we believe that upstream prevention is really the key to improving health and sustaining our economy. I am also here before you today as a rural ratepayer, a lifelong Kentucky consumer. I have 2 daughters under the age of 3 learning how to brush their teeth, and they have a baby brother do any day. So I do take this work very seriously. As a coalition led by consumer voices, we travel the state and talk to Kentuckians using Medicaid for their health care, as well as the community professionals who are helping them navigate having their basic needs met. Among these conversations, we ask about barriers to care, and oral health is almost always the number one unmet need, followed very, very closely by transportation. Kentucky consumers deserve and have a right to clean air and water just to support good health, if nothing else. Regardless of your socioeconomic status, every single one of us in this room is at the mercy, and we have to rely on our local water districts to deliver safe water, safe fluoridated water. While the federal judge in California issued an opinion last fall charging the federal EPA to investigate and provide some of those safe levels Dr. Call was referencing, the EPA has since challenged and appealed that decision since September. First and foremost, however, I am very, very grateful to know that Kentucky's very closely monitored fluoridated water is well below that of California's. The judge referenced, like Dr. Call mentioned, a 1.5 milligrams per liter, or the parts per million level, and that high concentration is not used in Kentucky. Kentucky's target concentration is 0.7 parts per million, with an acceptable range as low as 0.6. And to save money, the vast majority of Kentucky's water plants hover at that 0.6 value. It's not half of 2.5, it's 2.5 times less the value of that high concentration that is alarming. But thankfully, it costs very, very little to support safely fluoridated water. We pay about 50 cents per person per year to maintain fluoridated water. And without it, the cost of dental decay, as you heard from Dr. Robertson, can quickly spiral exponentially, especially for our vulnerable populations. Among the $19.7 million per year cost impact to Medicaid alone that Dr. Robertson referenced, $17 million of that is specific to children's impact. And the numbers affected are, per 10% population impact, 68,000 children and 90,000 adults. And with every 10% increase that figure. So 30,000 or 20,000 would be 136,000 children impacted directly. Besides costing taxpayers millions of dollars more than maintaining low levels of fluoride in water, the fact of the matter is that we simply don't have the number of dentists we need to treat all of this decay. We know that fluoride is a necessary tool when it comes to preventing dental decay in cavities, and yet we have entire counties that are deserts, dental care deserts, and they would certainly be hit the hardest. If we're going to knowingly increase a healthcare need, and we know it's already not being met, we must at least reinforce that healthcare workforce and provide the critical education and resources beforehand so as to respond to that need. With so much uncertainty as there is right now on the future of federal funding for Medicaid and other public health programs, any effort we can to make unnecessary decay, it'll require millions of additional dollars to treat each year, and so we shouldn't be putting that on the backs of our local governments. The healthy and responsible decision here for all Kentuckians would be to delay this until we actually have more information to support why we should remove fluoride from water. So I thank you for your consideration in voting no against House Bill 16 today.
Thank you, Kelly. We do have, if you can just stay nearby in case there are questions. All right. We have Dr. Brittany Rawlings online. If you would like to make a few comments, we welcome you. If you can just introduce yourself for the record, I'd appreciate it.
Yeah, hi, my name is Dr. Brittany Kamenish. My married name is Rawlings, but legally I'm Brittany Kamenish. I'm a professor at the University of Kentucky in the periodontal department, and I also own a private periodontal practice, of which most of my patients travel about 2 to 3 hours. That's the average distance to get to me in Richmond, Kentucky. So access to care is a huge issue here. Previously, I served as a general dentist at a FQHC and as a student dentist on a mobile dental team in Eastern Kentucky. And more importantly, I'm a lifelong Kentuckian, advocate for access to public health, and a mom whose daughter has access to fluoridated water. Today, I want to talk to you a little bit about the importance of the prevention of dental cavities. Dental cavities in children remain the most common chronic childhood disease in the United States, and the severe tooth pain associated with dental cavities is the most frequently cited reason for children missing school. Based on a systematic review of 5,000 papers, water fluoridation remains the most effective and socially equitable means of achieving community-wide exposure to cavity prevention effects of fluoride. As dentists, this is something we see every day. In the United States, 46% of children 2 to 19 years old have had at least one cavity. In 2023, 6,660 kids in 106 counties across Kentucky were examined, and cavities in children in our state were found to be significantly higher than the national average. In some areas, we found this rate to be 85%. That's according to the CDC as well. This is comparable to levels of cavities seen in high-risk groups in the United States, children living at or below 100% of the poverty line. Excessive use of any substance was brought up. Fluoride, table, salt, Tylenol, processed food, even plain water can have negative effects on the body in excessive amounts. Documented health effects have been seen with levels which we discussed. In Kentucky, our levels are 0.7, whereas we already discussed the toxic level of 1.5. Proponents of this bill, I encourage you to think about the possible negative effects of leaving fluoride out of water. I encourage you to think about the definitive negative effects of removing the fluoride. The state of Kentucky already has vast disparities in access to dental care for both children and adults. With no long-term plan for quantifying success of this measure, removing the free and publicly accessible caries prevention measure that is water fluoridation removes a crucial social safety net and will lead to an increase in cavities, pain, and missed school for the most vulnerable in our community. The cities that would be saving, they said that maybe some cities would save like $600,000. I did some quick math. It does not account for the cost of treating and managing cavities, missed days of schoolwork, and the damages of dental pain. Every dollar spent on fluoridation yields as much as $32 in reduced dental expenses, according to the American Medical Association. That's $600,000 in water fluoridation is theoretically saving Kentucky $19.2 million in dental cavity treatments. Fluoride is successful in preventing cavities. This is a fact. Another fact is that passing this legislative action will harm children in our state. There are other ways to improve the health of our population. They require collaboration, research, resources, open minds, and purposely thought out plans to prioritize long-term success. As healthcare professionals and legislators, we have a duty to protect the public. Our decisions should be based on science and not on sensationalized political topics. Thank you very much.
Thank you. Thank you, Dr. Kaminish. Sorry, I almost called you Rawlings again, but thank you for being here. We have a motion and a second, but we have a few other folks who have signed up, and I do want to allow for some questions as well. Is Tracy Pulley here? Are you online?
Yes. Hi. I'm Tracy Pulley. I live and work in Fulton. Fulton is the last county at the southwestern corner of the state, so we're on the Tennessee and Missouri state lines. I run the Family Resource Youth Services Center for Fulton Independent, and part of my job is helping children with their healthcare issues, and so I'm always glad to speak up about dental health. Last Friday, the CARE mobile dental vans came to our school. They are the only option we have right now in terms of local dentistry because there is no dentist in our county. And last Wednesday morning, a parent texted me that her child was going to be missing school because he had an abscess and he had a terrible fever. And so those statistics about children missing school because of teeth pain, of course, they're real and they're happening here, but I just wanted to share how painful it is to see children in pain. I I'm just very grateful to you all as a committee that you promote health services across our state. Our health department here is crucial, and fluoride in the water is, for 80 years in America, has made a positive impact. So I'm grateful for your a moment of your time, and grateful that you all will make a decision that does not make things worse for the children of our state, because I see children with tooth pain on a regular basis, and it is really heartbreaking. And trying to find them 70% of our kids have medical cards. Trying to find a dentist, they're 25 to 50 miles away from us, who will even accept a child with a medical card is becoming virtually impossible. So again, we're having to rely on this mobile dental van, and we're just barely. Our children are barely making it. And the boy that I just mentioned from last week, they had to pull his tooth Friday, so he lost a molar because of that. So thank you for your time.
Thank you so much. I appreciate your being here. We have one more person online, Jennifer Harrison with the Kentucky Oral Health Coalition.
Good morning. Thank you. I'm representing the Kentucky Oral Health Coalition and the Kentucky Dental Hygienist Association. Jennifer Harrison, as she said, I am a dental hygienist, educator, and mother. I proudly and confidently drank fluoride while pregnant, and thankfully my 8-month-old son has the access to drink it daily as well. The Kentucky Oral Health Coalition is a statewide network of dentists, hygienists, oral health professionals, and oral health advocates working to improve oral health for all Kentuckians. Access to community water fluoridation provides an equitable prevention measure to reduce dental decay, especially among kids, as you've heard from other folks. In partnership with University of Kentucky College of Dentistry, I just finished a surveillance project where we screened over 6,600 Kentucky kids between the ages of 2 and 5. Decay rates among our youngest Kentuckians are above the national average, with some regions seeing nearly 40% of kids under the age of 5 with untreated decay. Jeopardizing our community water fluoridation programs by allowing localities to opt out of the program only increases this risk, one that we cannot afford to take. Untreated cavities lead to pain, swelling, infection, as Tracy mentioned. This impacts behavior, the ability to learn, sleep, and their overall quality of life. And that infection can spread to anywhere in the body, even risking sepsis or death for kids. Kentucky, like many states around the nation, is experiencing a crisis in our healthcare workforce, including dental providers. We've talked about shortage areas today. And something else to mention is that because of these shortages, a lot of Kentuckians are forced to delay care or seek relief in an emergency department, with really costly outcomes to our Medicaid program. In the schools of West Louisville, I have treated children who were suffering in silence due to untreated infection. I have cried many days out of the shock and frustration of helping families try to find care for their kids, even in an urban area, with offices that are months behind on available appointments or don't accept insurance at all. I'm sorry?
I just don't see that this is germane to this bill that we're talking about. Just pointing that out. I appreciate you coming and testifying, but I don't see how this is germane.
Thank you, Representative Callaway. Yeah, we're talking about dental health and oral health, and it is all part of this conversation. Thank you, though. You can wrap up if you still have something to say.
Yes, I just wanted to say that ending community water fluoridation would worsen this already urgent problem. Dr. Robertson mentioned the Medicaid increase. This is in addition to the impacts we will see in workplaces and schools as dental treatment needs impact Kentuckians' ability to work and learn. I appreciate the ability to speak today. As you all can tell, I'm very passionate about protecting Kentucky kids and protecting community water fluoridation. I do believe that what I said today directs is directly related to the bill. If it were to become law, water systems across the Commonwealth will have the opportunity to remove fluoride from their water supplies, but it does not address the costs the action will result in. It does nothing to ensure fluoridation supplementation programs are able to meet the increased demand they could see in areas that no longer have access to fluoridated water. And it does not provide solutions to ensure our dental workforce is equipped to meet the current treatment needs or the increased needs that will result if fluoride is removed. We have a duty to protect our most vulnerable here, and those are Kentucky kids. I encourage committee members to consider the unintended impacts this bill will have on our Kentucky communities and vote no today.
Thank you so much for being here with us today. I appreciate your comments. We have one more person online, Dr. Christine Perez. She's the director of UK Pediatric Dentistry. Are you online?
I am.
Okay, if you can introduce yourself for the record. We don't have your video.
Okay. So am I hearing that you're not
There
seeing
you
me?
are. Okay.
Okay, I'm
See you
here.
now. All right, just
Hello,
introduce
hello.
yourself for the record, please.
Hi, everyone. Good morning. My name is Christina Perez. I am the Pediatric Dental Program Director for the University of Kentucky. I'm the Residency Program Director, and I am also a pediatric dentist and have been for the last 20 years. And I really have nothing prepared, but what I want for everybody to know is what we see every single day in our clinic. Firsthand, we can tell you the damage that we see and the children that are hurting and infected because of lack of access to care or difficult of access to care. And we feel like that is directly related to the fact that they are not able to receive treatment. If fluoridation was not in the water, we would go back to seeing levels that we had before water was fluoridated, and that's about 90% of our children would have decay. So it's very difficult to deal with. We feel like it's very important for fluoride to be in water. I can tell you firsthand because I was born in Chile, and in Chile there is no water fluoridation, and the caries rate for children under 6 years old is 90%. So not only is that a problem for those who can access to care, but those that don't just end up receiving emergency treatment. So I just reach out to everybody to let them know that water fluoridation makes a difference, that the topical effect is great, but systemic effect is even better because it ends up being topical. Once it's in the saliva, then it becomes topical as well. And that is true. That is the best effect of fluoride. However, there's many people that don't have access to a toothbrush and they don't have enough information to even know to use fluoridated toothpaste. So this would be something that is certainly not damaging and certainly affects and helps everybody the same way.
Okay, thank you so much, Dr. Perez. I appreciate your being here and taking time to address the body. I'm going to go ahead and open it up to questions. I have a quick question for, I think, probably Dr. Perez or any of our dentists, but Dr. Perez, you're a pediatric dentist. So I just think that it's important that we all kind of understand what fluoride does in terms of tooth development. Can you kind of walk me through early tooth development and how fluoride either positively or negatively would affect an infant and a child?
Sure.
Thanks.
So fluoride it's sincerely very important. It can be consumed by the mothers in an effective dose, of course. It goes through the placental barrier and it is able to help in development of teeth. So teeth start developing very early in life. About week 10, we can already see developing tooth buds. Now, these tooth buds can develop different ways. Now, if fluoride is in the system, then these teeth not only have a better outer shell, but also the anatomy is seen to be different. So it doesn't, those teeth don't come in with big pits and fissures. The anatomy is smoother, so less cavities from that point of view as well. The systemic effect is important, yes, but the systemic effect that turns into topical effect is even better. So what fluoride does systemically turns into the saliva. The saliva bathes the teeth once they are in the mouth, and that is the best effect that you can get. So yes, when the teeth are developing, it's great. It makes teeth a little stronger and it makes the anatomy a little better. But sincerely, if everyone would drink water once their teeth, tap water once their teeth are in the mouth, we would get that local topical effect as well.
Okay. Thank you very much. I appreciate that. I just wanted folks to understand that it's not just in children at preschool age, or we're talking about tooth development as well. So, okay,
and it's everybody. Everybody can benefit from this. So we have teenagers that are very high risk. We have special healthcare needs children that just are unable to brush, and so sincerely, it is one of those measures that I feel is very important.
Okay. Quickly, do you have any knowledge, or does anyone here who's been speaking have any knowledge about other countries who, you've talked a little bit about Chile and your experience, other countries that don't fluoridate their water, and states maybe who have pulled their fluoride out of water? Are we seeing any untoward effects, or what are you seeing?
Jennifer, I think you're muted.
Okay. All right. We have two folks coming to the table, and Representative Hales.
Thank you, Madam Chair. May I make just one more statement, and then
sure.
This is all I will say. I think we've kind of gotten off what this bill is about. I emphasized this earlier in my testimony, and this distinguished gentleman, Dr. Robertson, here said the same thing. This is not an anti-fluoridation bill. This bill, if passed and would become law, would not remove fluoride from water. All this bill does is just give local control to the local water governing districts
to remove fluoride,
if they so choose. But this bill itself.
You're right. Absolutely. Thank you. I just want everyone to know what the potential ramifications are.
I understand.
That's all.
Thank you.
I think it's important. Dr. Robertson, do you want to comment? And then maybe Cindy.
Thank you. This short response, I think, to what you're asking about, what experiences have other communities had, is probably the two that have been the biggest in the news are Calgary and Buffalo, that removed water fluoridation, and then within a decade went back to water fluoridation because of the effect that they saw that happened on their community. And I understand exactly what Representative Hale's referring to about the bill, but we're worried about that potential effect of the ultimate outcome of these, especially smaller rural communities, deciding to make that change. And we do have some larger communities and a lot of information that's available out there about what the experience that they had in Calgary and Buffalo that led them to return to fluoride. But, that's really our stance, is we just would really like to see the mandate stay in place to help protect the citizens of Kentucky.
Okay. All right.
If I could more specifically answer your question, this is a graph from the World Health Organization showing from 1965 to most currently, the reduction of tooth decay throughout the world. And if you can't see the colors, there's about half of them that are countries that are unfluoridated water, and the other half fluoridated water. And you can just see the trend. It's very clear. Now, certainly there's all these anecdotal stories and observations made by various practitioners that go around the world and see all the horrible things. And we're the kind of the focus of attention when we show up with our skill set to fix the problems. But this is data.
Okay. Thank you. All right. Representative Callaway, did you have a question?
I guess it is a question, probably more of a comment. We keep hearing, and the reason for my mentioning of Jermaine, our Representative mentioned it. We're talking about lack of access in each of these testimonies. And that's not really what we're talking about here. We're talking about local municipalities having the authority to remove it. So you've addressed some of that. But, and I hear testimony about we visit all these places that don't have fluorinated water, but they throw in and don't have access to fluoride. So we do have access to fluoride. I remember them bringing trays around when we were in school of fluoride in cups that we would swish, spit it back in the cup, and remove it. So saying that we don't have access to fluoride, it just doesn't. It's just not true. So lumping us in and that doesn't make a case for me. And even if it did, we're not giving a blanket approval for our water companies to put whatever chemicals in that they want, just because we're saying that some chemicals are acceptable. So I think it should be up to the local municipalities to make their case about whether they want it or not, and which is what, again, this bill does. Again, the untreated dental care, saying that maybe 90% of individuals would go back. If we're advocating for something we already have in place and we're talking about the low dental rates, I just don't see that that's making a case for it. We've been treating, and yet we have low dental care rates and low dental health rates in our state. So make sense for me. But the other thing, I have spoken with Louisville Water Company. We sat across the table and had a discussion about this. And I've pled my case that my constituents, they want clean water. That's what we hire. That's what we have Louisville Water there to do. We want clean water. And yes, it does take some chemicals to do that. This is not one of those chemicals. So to take that into their own hands, to say that ultimately they're probably going to. If this passes, Louisville Water will still probably continue to fluorinate our water. So, but I'm called to be a voice of my people, and what I've heard back from this is we don't want to be ingesting something that could be just rinse topical. Okay, so if we have that discussion about that it is good for our teeth, if mothers should be ingesting it, let's let mothers ingest it, if that's the case. But blanketly putting it in all of our water, I just have not heard a case for it at all. I'm proud to co-sponsor this bill. I actually signed on to co-sponsor, again, knowing full well that my municipality probably will continue to do what we've been doing. And I do want to thank the co-sponsor who's not here, or the sponsor, main sponsor of the bill, who's not here. I hope that he can come back with us soon. Thank you for stepping in. But I don't think what we've been discussing here, if we need to address untreated regions, if lack of access to dental care, let's do that. Why are these people? Nobody wants to see children having tooth pain. Nobody wants that. We have ways to combat that without requiring everyone to ingest, even if there's a chance that it's harmful. So to have these discussions at a local level, I think is important, and I appreciate hearing the bill. Thank you for hearing the bill.
Thank you so much. Representative Fleming.
Thank you, Madam Chair. Representative Hale, can I say heart, but thank you for pitching in. My question goes to exactly what your point is, and that is the governing body of the system. Louisville Water Company is wholly owned by Louisville Metro government, which puts in about $15-20 million dividends into local government. Could you give me an idea of the rest of the state in terms of ownership or in terms of a governance of these water districts? Are they somewhat privately owned? Are some of them, quasi-owned? Or are they solely owned by government?
Thank you, Representative Fleming. That is a great question, and the answer is some of all. There are some of all of that. One of the things that I did not actually mention in my testimony, and I knew we were time limited, but if you have a governing body that then turns around, and this happens quite a bit in the rural areas where I live, is they actually sell that water to other municipalities or other towns or cities. And so those individuals that the person that would make the ultimate decision would be the governing body who owns the water system itself. So, but to answer that question, there are some of all of those that you just mentioned there.
Oh, Madam Chairman, follow up. Thank you very much. Dr. Robinson brought up an interesting point, which I thought about earlier. And you mentioned that there is a mixed bag of ownership, and I appreciate that, and that's good. That's part of where we live in the United States. But when it comes to putting something into the process that affects our health and so forth, and if you have a private entity or a governing body of that system, it's going to be their decision on what they put into the system, or they sell a product, whatever. My thought is this: under Louisville Metro government, it would still go through the government process, and quasi, it might be the same. Is there some consideration or thoughts to put some additional language in there that it needs to go to a local government of either a city or a county in order to take it out or keep it in?
Well, actually, not being the main sponsor of the bill, I probably should not answer that question. I think that would be one that
I don't mean to put you on the spot.
That Representative Hart would probably be more inclined or should answer that more than myself. But I think I better leave that answer to him. If that's not avoiding the question, but
no, I
better leave that to him.
Thank you, Representative.
Since he's home watching us here, I better leave that to him.
Representative Camuel.
Thank you, Madam Chair. And I've got a couple of questions, if possible. One of the questions I have in listening to the presentation of the bill and proponents and opposition in the bill, one of the questions I have is, how does this address potential disparities in access to dental care, or in the case of folks who don't have access to the fluoride, who will provide that to them?
Well, I will let either one of the gentlemen answer that. My position on this bill is this is just a local control, giving local control back to the governing bodies as to whether they decide to put that into the drinking system or not. But repeat the question to me again.
Sure. I was just trying to figure out how does this bill, how will disparities in access be addressed if in the event to like access to dental care or access to fluoride? How will those disparities in, say, rural communities or poorer communities where they don't have access to, say, fluoridated toothpaste or don't have the educational background, to understand what needs
I understand,
to be done?
yes. Well, again, I think the access, of course, would be the group that makes the decision, that governing body of that drinking water system. They would make that decision, and as far as how it would affect the individuals in their districts or their areas, of course, that would be something that each individual or each group of people would have to make a decision of how they wanted to proceed beyond that. And that I may not answer that the way you wanted to.
No, I appreciate it. And if I may, Madam Chair, one more. Okay, thank you. One part of this process of if the bill passes and there's defluoridation, there are going to be unintended consequences on Medicaid. How are we going to cover that? Like, what are we going to do to ensure that there is good oral health throughout the state of Kentucky and available to all Kentuckians?
Well, I would have to answer that. Of course, I listened to the comments that were made as far as how this would affect what the cost of to Medicaid would be. Of course, that study came from the cabinet that gave those that information, which was requested. But I just want to direct your, and I'm not arguing about that number, but I just want to give you a couple other things that came from that same cabinet information that was delivered. And I had a copy of that, and I just want to read you. I mean, even though they made this statement that it was going to cost this much money and could affect that much X amount of dollars in Medicaid, but you have to take into account of also in that same study, the same group the same cabinet folks that sent that study also made statements, and I will, if you'll allow me, I will just read that statement. It says, if fluoridation is removed from water in a certain area. This could lead, it does say it could lead, they believe that it could lead to dental decay, but it also says it results in more opioid painkillers, antibiotics. Therefore, removing this causes intensifies opioid and heroin crisis and the rise of antibiotic resistance bacteria. So I look at those statements, which I think are almost, how could they say that is a direct result of someone not getting fluoride in their water? I think those are absurd statements, and so I take that statement, and I'm not doubting the amount of the money, but what I'm saying is I look at that complete study that came from the cabinet and some of those statements right there, so I take that for basically what it's worth to me.
I appreciate that, and just in reference to the statement that you read, and I think we kind of touched on it, when there is dental decay, there is increased pain and then a need for pain relief. So that was how I read that or understood that statement. So thank you. And thank you, Madam Chair.
Yes, ma'am. Thank you. And Representative Proctor.
Thank you, Madam Chair. I'll keep it brief. I'm aware of the time. I just have one question, if I can ask Cindy, please. Thank you, Cindy. I've heard your testimony before, and I really appreciate that. There's some things that you did in your last testimony that I've forgotten. If you could just refresh my memory on, can you share with us what exactly is added to water to increase the level of fluoride in the public water?
Yes, I can. What's used is a product called hydrofluorosilicic acid. In 2018, when this bill was filed, one of the reasons that I was prompted to call my state representative was because I brought my own government, my local government, in and wanted to share this with them after I learned it. So water systems bid out to the lowest dollar the chemical that contains fluoride to artificially elevate the level in their drinking water. And ours came from a company in Florida, and it was a phosphate fertilizer manufacturer. It is a chemical that is a byproduct of manufacturing phosphate. When they pull the rocks from the Earth's crust and they pulverize them, it creates a vapor that's captured in a smokestack because the EPA regulates it to be too toxic to be emitted into the environment. On top of the smokestack, because it can't be emitted, there is a wet scrubbing mechanism, so water drips down into it, which creates a liquid, and that liquid is trucked over to what's known as a cooling pool. What is solid sediments to the bottom, what is radioactive, again, all from the Earth's crust, evaporates off, and the slurry that's left is what's trucked to our water department. If it wasn't being sold to our water department, it would have to be disposed of and neutralized and disposed of by a hazardous waste company. So on our chemical, there's a stamp on it that says 25% hydrofluorosilicic acid or 23% hydrofluorosilicic acid. And in 2014, an independent biologist tested that product and found, as expected, that it did have other elements from the Earth's crust, heavy metals, arsenic, manganese, aluminum. So we've heard these testimonies about access to fluoride, but it's not a pharmaceutical grade product. It is someone else's pollutant, essentially. So thank you for asking.
Thank you so much.
Okay, I want to thank everyone for this really great discussion. It's been enlightening in a lot of ways. I want to, as we make these decisions, make sure that everyone is making an informed decision. And, a few things. I would be more comfortable personally if there was an elected body making this decision. I'm not sure that the water districts want to have to make this decision. So I'm hesitant for that reason, but I absolutely understand the desire for a local decision and to listen to our constituents. I understand that. I understand the desire for clean water. I mean, we all want that. And I think as we are having these conversations on a state level and even nationally about what's in our food and what's in our water, it's important to have maybe some more studies. So I don't see any further questions, and we have a motion and a second on the bill. I am inclined to go ahead and take a vote, and we will see what happens on a local level. But I don't know how this is going to be operationalized. The way it's written, I would like to see language that maybe clarifies that, and also some language that would clarify any sort of offset in additional Medicaid costs. So anyway, we're going to go ahead. DJ, please take the roll.
Representative Bratcher? Yes. Representative Bray?
Yes, briefly explain my vote. Thank you all. I spent a lot of time in a water plant long time ago. Just want to make it very clear, fluoride is not used in the water treatment process to produce clean water. It is absolutely an additive. It is, at the water treatment plant level, it is a very caustic additive, causes a lot of corrosion. But one thing that I am happy to hear today is we're very concerned about Medicaid spending from both sides of the aisle, and we're concerned about babies in utero. Thank you, ma'am.
Representative Burke?
I'd like to explain my no vote. We come back year after year to fix unintended consequences. There are famous examples of places that have defluoridated their water and had to come back because, oh my gosh, unintended consequences. So all of a sudden, just like Representative Bray, I'm shocked to hear that today we care about local control, because all I've heard all session is how local municipalities don't know what's best and we need to control it from Frankfurt. This is a public health issue. That is not something for local government to determine. The reason that it's appropriate for this to be a state government decision is because it requires good science. And when we leave that to local governments, we put them in a very awkward position. If they defluoridate their water and take those things away from their water systems, and then 10 years later realize that their families and children and adults are all suffering from dental decay, it's going to be very expensive for them to fix that. We know that to be true because you can look at Calgary, Canada, and the fact that it cost $25 million to refluoridate their system. We don't have $25 million to waste on anything. Our budget is very slim. Our people deserve better. I'm a no.
Representative Callaway?
I'm an aye, and I want to reiterate what Representative Bray said. I just want to second that. Happy to hear that.
Representative Camuel?
Yes, I'd like to explain my vote. I'm a no today on this bill. It's much more cost effective, I think, for individuals who want to eliminate fluoride from their from usage by going out and purchasing inexpensive water filtration pitchers. You can also find countertop options as well as whole house installations that will cost a lot less, anywhere from $60 for highly rated ones to $700 installed. $800 installed. So my recommendation is that we don't make a decision based on the whim of a small number of people that will impact millions of Kentuckians. So I'm a no. Thank you.
Representative Dotson?
Yes, I'd like to explain my vote real quickly. We don't know the totality of all the side effects that come from fluoride. It's been given over the last 35, 40 years, and as Representative Callaway, we used to take it in school as well. We don't know the side effects of any of these things as far as cancers, Alzheimer's, dementia, these things. So there's not, maybe we need to do more testing. But I think for now, people should have the option to opt out of taking fluoride if they need to. Thank you.
Representative Duval? Representative Fleming?
Explain my vote. Thank you, Madam Chair. I'm going to quantify my yes vote to say this, is that I'll reach out to Representative Hart. I do appreciate Representative Hale going through and explain this, but I think I like this guy. Reach out to him to look at putting in language as an amendment on the governing body of the district. And also I concur with the chair in terms of looking at Medicaid costs, and we need to be concerned about that while, but I am a yes, if you don't mind.
Representative Gordon,
Yes.
Representative Holloway,
Yes.
Representative Marzian,
Explain my vote briefly, Madam Chair. I'm a no. But the fact is that fluoride stops cavities. Cavities have to be treated, and there is an alarming shortage of dentists in rural Kentucky. We know that. And years ago, Paul Mason from Letcher County said when kids have teeth that hurt, they can't go to school. And his county could not afford dentists, or Medicaid did not pay for dentists. So we're going to lose out on education. We're going to lose these kids to opioids. And this is a terrible bill for our Medicaid department, for our kids, for our rural areas. And a few years ago, Kentucky had the honor, I guess, of being the state with the most amount of folks with missing teeth. So I guess we could keep that honor, but I vote no.
Representative Neighbors,
Yes.
Representative Proctor,
Yes.
Representative Rayburn,
Yes.
Representative Raymer,
Yes, and I just want to thank Representative Hart that couldn't be here today for his hard work on this bill.
Representative Riley, Representative Sharp, Representative Wilner, Chair Mosier.
I'm going to explain my vote. I am still not comfortable with the potential for just adding to our poor oral health, which leads to other medical conditions in our state. I will have to see some additional language also that is going to offset our potential Medicaid costs. And also the local control. I just don't know how this is going to be operationalized. I hate putting the burden of voting on this issue on our water district, our unelected officials in our regions. So today I'm going to be a no, but I'm going to look at additional language and I might change my mind. So thank you. Okay. House Bill 16 passes with 11 yes votes, 4 no votes, and no passes. Thank you. Oh, okay. We're going to leave the committee open for a second to record a few other votes. Representative Raymer.
I'd like to record my attendance and record yes votes on House Bill 392, 580, and 688.
Thank you.
Thank you.
Okay.
Thank you,
Are there
Madam
any
Chair.
other Representative Proctor?
Yes, thank you. I'd like to record my yes votes on House Bill 580 and House Bill 688, please.
Thank you. Okay. All right. I think that is it. Having no further business to come before the committee today, we are adjourned. Thank you.